Okay, I'll ask you a question. A patient comes to you with a balance disorder. You have to prescribe a cane to the patient. The patient is saying, I'm not old enough to use this. I'm young only, I'm not old enough to use this. It will look like old enough when I'm using this. So like that they are saying, and they are trying to refuse it. But you know very well, the cane is important to them. How will you convince them, and how will you make the patient to accept the cane, and how will you start gait training after that?
I will tell the patient to use the cane because when they're using the cane, it will be better to gain the balance.
Yes, okay, that's right. One thing is, they are reluctantly refusing to use this. First of all, we have to make the patient to hear what we are speaking. See, until last week, the patient was fine, or last month, or last 2 or 3 months, the patient was fine. Now, after this, within these 3 months, or 3 weeks, or one week, or something, they are not fine. Their balance is missing. Already, they will be in stress. Imagine that they are working in an industry, like the CEO or a manager. Some 1,000 people or 500 people will be working under them. So when they are going to the industry, they'll think that they will be like, they'll have certain dignity. So in front of all the people, they cannot use cane immediately and all of a sudden. So everybody will speak behind. So they will think about that. They will think about the dignity. They will think about the position. So first of all, we have to understand the patient's emotions and the feelings, whatever it may be. It's in the family or in the workplace, whatever it may be. We have to understand the emotions and the feelings of the patient. So first word, what we have to say is, yes, sir, I can understand. I can understand your feelings. I can understand your emotions. Yes, I know. As a CEO, as a manager, when you are going into the company, it's not fine. Until yesterday, you were fine, and now it is a dignity issue or prestigious issue. So when you are using cane, everybody will speak about that. Yeah, okay, I can understand. So it will be something hard for you to use it. Yes, I can understand. But at the same time, your balance is missing here. So you were good until few months, but now your balance is missing. You will fall down at any time, right? So imagine in front of those 500 people or 1,000 people, you are falling down. Do you think that will be dignified? No, that's not good. Do you think that will be prestigious for your position? That's not good, right? So if you are using cane, nowadays we have modern canes, and it's a very decent canes we have. So if you use cane, you won't show it outside easily. People will think something small things has happened, and he is using like that only. People will think like that. We can use some simple canes. So for that, I'll give guarantee. I'll make use of a simple cane. So I'll give you a simple cane, and after that only, after using that cane only, we have to go for how to walk with the cane, what to do, what not to do. I'll explain. I'll be with you. Don't worry. I will be with you throughout the entire session until you completely come out of this scenario, the balance issue. I'll be during the entire course. I'll be with you. Don't worry. No problem at all. I will help you. What are the exercises? I will teach you. Like that, you have to give hope. And believe me, you are not going to use the cane for a prolonged period of time. Maybe for a few months. Within that short period, you will do all these exercises. You will cooperate with me. You will do all the exercises, and after that, easily you will come out of this. I promise you. Like that, you have to say. So that after that, they will get some confidence. They will think about their own scenario and dignity and prestigious issues in the workplace or in the home. After that, it will be fine. After that, they will accept. After that, you can go for. After that, you can go for prescribing cane. Which cane will be suitable for him? Which cane will be something gentle for him? Prestige, or without spoiling his own dignity or his image, we can use simple canes. Okay. After that, we can go for, from the next day or something, we can go for exercises which will strengthen the hip muscles, knee muscles, thigh muscles, etc., or the trunk muscles, upper limb muscles, which is necessary to use the cane. Okay. So this will be a good course. After accepting their emotions and feelings, giving respect to their emotions and feelings, we are going in this phase. So this will be a better attitude when compared to something directly we go and explain, right? So that's what the scenario.